Hello learners and welcome to our channel P.K.Pharmacy. Today's video on medical coding questions and answers. If you are preparing for interview, this video will help you. Don't try to skip and watch till the end.
Question number 11. What is diabetes mellitus and explain its types? Definition of diabetes mellitus. Diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose or blood sugar, which leads over time to serious damage to the heart, blood vessels, eyes, kidneys and nerves. Types of diabetes mellitus. Diabetes is due to either the pancreas not producing enough insulin or the cells of the body not responding properly to the insulin produced. Type 1 German mark. Type 1 diabetes mellitus, known as insulin-dependent diabetes mellitus, also called juvenile diabetes. Body failure to produce enough insulin. The causes is unknown. Type 2 German marks. It begins with insulin resistance, a condition in which cells fail to respond to insulin properly. As the disease progresses, a lack of insulin may also develop. This form was previously referred to as non-insulin dependent diabetes mellitus, or adult-onset diabetes. The primary cause is excessive body weight and not enough exercise. Gestational diabetes is the third M.Pharm and occurs when pregnant women without a previous history of diabetes develop a high blood glucose level. Question number 12. How many lobes in lungs? The right lung consists of 3 lobes. Right upper lobe rule. Right middle lobe RML. Right lower lobe RLL. The left lung consists of 2 lobes. Left upper lobe LUL. Left lower lobe LLL. Question number 13. What is role of hypothalamus? Hypothalamus regulates the following functions: childbirth, emotions, sleep cycles, balance body fluids, appetite or thirst control, blood pressure or heart rate, body temperature, body weight. Question number 14. What is dialysis? Dialysis is an artificial way to eliminate waste and excess fluid from the body. If the kidneys are not functioning properly, waste starts accumulating in the blood. This results in coma and even death. Question number 15. What is pleural effusion? A buildup of fluid between the tissues that line the lungs and the chest. Fluid can accumulate around the lungs due to poor pumping by the heart or by inflammation. Question number 16. Explain coronary artery disease. Coronary artery disease (CAD) is caused by plaque buildup in the wall of the arteries that supply blood to the heart, called coronary arteries. Plaque is made up of cholesterol deposits. Question number 17. What is beta blockers? A type of drug that blocks the action of substances, such as adrenaline, on nerve cells and causes blood vessels to relax and dilate. This allows blood to flow more easily and lowers blood pressure and the heart rate. Question number 18. Explain ECG. ECG, having long form electrocardiography, is the process of producing an electrocardiogram, a recording of the heart's electrical activity through repeated cardiac cycles. It is an electrogram of the heart, which is a graph of voltage versus time of the electrical activity of the heart using electrodes placed on the skin. Question number 19. Explain CT scan. Computed tomography is commonly referred to as a CT scan. A CT scan is a diagnostic imaging procedure that uses a combination of X-rays and computer technology to produce images of the inside of the body. It shows detailed images of any part of the body, including the bones, muscles, fat, organs and blood vessels. Question number 20. Explain atherosclerosis. Atherosclerosis develops slowly as cholesterol, fat, blood cells and other substances in your blood form plaque. When the plaque builds up, it causes your arteries to narrow. This reduces the supply of oxygen-rich blood to tissues of vital organs in the body. Normal artery and an artery with plaque buildup.